We're going to talk about the skeletal anatomy relevant to the hip joint intra-articular injection. To perform this injection, you will use a curvilinear probe, which is recommended, as a curvilinear probe will give you much more wider field of vision as compared to linear probe, where the field of vision is narrow. To start scanning this, your area of interest would be the femoral head and the femoral neck junction, as the capsule of the hip joint extends all the way over the intertrochanteric area. So if you put the needle at the head and neck junction, the local anesthetic will spread intra-articularly. To scan, there are two ways to scan for this hip joint injection. Either you can scan the vascular structures, which will be femoral vein, artery, and femoral nerve. And once you've seen the neurovascular bundle in the groin, in the inguinal crease, you can then turn the probe at 90 degrees, looking for the head and neck junction along with the acetabulum and the labrum. The other way to scan would be is to scan the femoral shaft, come up. When the femoral shaft becomes flat, then you're looking at the greater trochanter or trochanteric area, and this is where you will turn the probe and move the probe medially, looking for the similar structure, the acetabulum, the femoral head, and the femoral neck junction. Now, how to needle this, how to perform the injection intraarticularly will be an out-of-plane technique is an option. My preferred technique would be in plane, going from inferior to superior, and put the color Doppler before you put the needle, because sometimes you will encounter the branch, the posterior circumflex femoral artery branch can be, a lateral circumflex femoral artery branch can be encountered in this area, where you want to avoid that in order to minimize the bruising in the groin. Intra-articular hip joint injection, patient laying supine, leg externally rotated. The starting point would be to place the ultrasound probe in the groin crease, looking for the neurovascular bundle. Once you see the neurovascular bundle, come down and you will see the acetabulum along with the femoral head. As soon as you locate the femoral head, you will be turning the probe along the junction of the head and neck, looking for the anterior recess of the hip joint, and you will see the muscular structures and the recess, and I'm going to point them out. The way to perform the injection would be in-plane technique, coming from distal to proximal. So let's focus on the ultrasound image. Here we have multiple structures that can be pointed out: the acetabulum, the femoral head, femoral neck. The bigger muscle you see on the top is the iliopsoas. You have sartorius muscle, rectus femoris. Needle needs to bring in plane at the head and neck junction, with the local anesthetic spreading medially and going into the joint capsule. Now, clinical tip or the pearls here: before you put the needle in, always put the color Doppler, because sometimes you can have a lateral circumflex femoral artery branch which may be encountered in your route. So it's always a good idea to put the color Doppler before you put, and I could already see the arterial pulsations here. And always try to locate the arterial pulsations and avoid them, because if you put the needle through the artery, the patient will develop bruising in the groin. So always a good idea to have the color Doppler. And once you have done the color Doppler and you know you have an artery that's in your way, you can actually move proximally, change the trajectory of your needle to get to the head and neck junction of the femoral head and neck junction.